talk about OAEs, we have our screening form here. We don't really start with OAEs unless it's all we can get from the patient. They're best for pediatric patients where you can't get a reliable response for. Remember, OAE stands for otoacoustic emission. It is the test that we use to see how well the inner hair cells of the cochlea are functioning. Remember, if we get a pass on the OAE test, this particular screening protocol tests 2,000 to 8,000 hertz, right? If we get a pass, then we can infer that the patient has normal middle ear function. We can also infer that they have no more than mild hearing loss, okay? We can't say they have normal hearing, we don't know. But we know we rule out significant hearing loss in those speech frequencies, okay? So some things we could miss with OAEs are low frequency loss. Remember, we can miss auditory neuropathy, we can miss auditory processing, we can miss slight hearing loss, all right? So that's OAEs, and how you do OAE, the screen is a touch screen, and it's actually a pediatric friendly. There's a child mode right here. I don't know if it's close enough so you can see it, but the child mode, you unclick or click, and that just makes this fun little cartoon appear on the screen for a child. But you can do quick start. You're going to select your protocol. So protocol, and just do protocol 1. Select the ear you're going to do. I'm going to wait and put this inner ear. So you put this tip, whatever size. I like these foam tips the best, but you guys are going to have to use these orange ones because that's all we have. This type of tip right here, you just squeeze up, kind of like insert earphones, and then you'll place it in the ear. Again, straighten it by pulling up and back. Place it down in the canal with the cord angled down, and just kind of hold it and let that foam expand. And then you're going to let go, don't hold it. I often will clip this here just to keep the cord from falling from the pressure of the cord pulling it out of the ear. And then I'm going to press, this is her left ear. And, oh, it's giving me an error message, which is awesome. So I need to check that out. Let's try a bigger tip. It's saying large cavity volume detected, so that really shouldn't happen, but they've been using these. And so I might need to change the probe. I'll try one more. And you see the balloons and then the plus. So they passed. Yay, good job. So that's the kid mode. If you take it off the kid mode, you won't see the little cartoon. The first error message that I got said large ear canal volume detected. So when I had this probe tip in the ear, it wasn't sealing off the canal completely, and it was detecting air was getting through, so that's why it didn't run. So now I'm gonna let you'll just switch ears, and then you'll go right into, click the right ear, and then you'll be ready to test. One thing to be careful, and I'll hold this while you do it. You get to be the model for this one. One thing to keep in mind with OAEs.
Yeah, right.
Yep, so put it in the ear. Actually, you'll pause it because it's going to run and you haven't got it placed yet. But that's a good thing to know. So we need to pause that. Now place the tip, and then you'll press the arrow to run it. And then clip there you go, attach the clip. And then just go ahead and push play. Oh, that screen, the glare's kind of. Yay, and passed, and push the save. And then you're done. So you've done both ears, and she's passed both ears. Some things to keep in mind about OAE is, I'll let you record me now.
Okay.
OAEs rely on a quiet environment. The kiddo cannot be talking, chewing, crying, any of those things. They will not pass. Tympanometry is more forgiving. The patient themselves needs to be quiet, but the room doesn't have to be quiet when you do tympanometry. You have to have a quiet room with OAEs. The slightest noise can interfere. Also, if you have a kiddo that's real congested and their mouth breathing and you hear that rattle in their chest or the in their nose, they most likely won't pass OAEs either because their breathing sounds are so loud. So it's just some things to keep in mind when you're doing OAE testing. When you take the tip off, gently just pull it off and then you throw it away. These are disposable. Don't twist and turn, and be very careful with the probe. Be careful with this portion. Always treat this equipment like this is $6,000 sitting right here. And it's calibrated every year. It costs us about $300 just for a person to come calibrate it and make sure that it's working properly. So any big drop will throw it out of calibration.